Hello, I'm here with Nicole Pernick. She is a TBI patient that wants to share her experience here at Renaissance Craniofacial Group of Physio Partners. Nicole, can you tell us a little bit about what happened to you and what you've been doing here with us and how it's changed your symptoms?
Right, so in the beginning, I had one concussion in 2018 where I severely dislocated my jaw and I struggled with aspiration for 8 months. And then my TBI came a year later in 2019 where I had blunt force trauma to my left frontal lobe, my eye socket, and then the left side of my nose. And that is when I developed my visual processing disorder, which I lost my ability to drive, read, look at a computer, watch TV. And then over time, I developed severe swallowing dysfunction that kind of overlapped on my already long process of aspirating. And then when the masks started during COVID, I developed hypoxia, which I struggled with until I came to Renaissance Craniofacial Group. And since then, I've had 3 sessions in cranial and then 3 sessions with Dr. Hobson. And so far, in such a short time, I've already improved in my swallowing, which is, I'm still on a soft food diet, but I've been able to eat sitting down, which I was never able to do before. And built great awareness in my tongue movement, so I can swallow water and pills easier. And ever since we did the nasal release, my eyes are so much, they don't fatigue as easy. I don't have strain. I've been able to drive and really have had little eye issues since we did that. And just breathing in general and the different techniques that I've learned can bring me back even if my eyes start to go or my swallowing starts to go. It brings me back right away. So it's been a complete game changer since I've started therapy for this, for the TBI a year and a half ago.
Can you describe what you were dealing with your eyes prior to the treatment here? Like what's a normal day for you?
So the left eye would fatigue if, let's say I turn my head left, and then I turn my head right, and the left eye would fatigue, and then my eyes would be doing 2 different things. And yes, it'd become blurry, but I would become mentally confused and anxious, and the rest of my day could be completely lost because I wouldn't be able to get my eyesight back. And my heart rate would go up, my breathing would increase, and it just created a monster of side effects just from that left eye.
So the craniosteopathy that you're doing with Kathy Matias Riggs, physical therapist, along with the nasal release, changed the eyes? Is it staying, or is it just a short-lived and comes back, the symptoms of the eyes?
So after my cranial work, I noticed overall just more efficient and effective cognitive processing. And so I was able to do my eye exercises longer. I'd be able to plan them out and just have better I know it sounds hard, but when you're always confused because your eyes don't work, it's hard to keep track of time and daily tasks. So with her, just being able to, she gave me the ability to even practice my eye exercises. And then it's gotten better ever since. I've never degressed so far.
And the nasal release, how did that then, it just amplified the improvement, or?
That allowed me the ability to look up. My eye gaze up has always been really weak, and ever since that I've been able to look up, and just the frame that I have in my peripheral vision is just wider, and I can see colors clear. I can see things don't get lost in focus anymore. So it's been, and my eyes don't strain. So it's just been a huge change.
And then these pretty goofy exercises that I make you do with the stick under your tongue, you holding onto these little squeezy balls and some earplugs. Just could you explain to the audience, you're looking at a focal point. What has that done in overall? What has it changed for you? These are called the Laynee restorative breathing method exercises.
Those definitely activate my parasympathetic nervous system. It brings me back down. Like once I start, if my eyes start to go, it just brings your nervous system back down to center, and you can reset yourself. So I use that all the time to reset myself whenever I feel anything funky or if just not practicing, and it just resets the body and the brain.
Wonderful. Well, I hope that we continue the progress, and it's been a great journey with you, Nicole. Thank you for letting us film this.
Thank you, Dr. Thomas.